So what does cheek augmentation mean? Well, it means making your cheeks bigger. That can be very powerful because what we want to do is make your eyes look bigger, and so light will bounce off your cheeks into your eyes and is a very subtle way of making you look much younger and more feminine. As we get older, our cheeks lose volume both from fat and from bone loss, and so there are a couple different options to increase that volume back, both from a structural standpoint and from a soft tissue standpoint. One option is using a cheek implant, and there are a wide variety of shapes and sizes, and you can even make a custom implant based on your individual anatomy. Another option is with autologous fat injection, so using your body's own fat to actually put back into the cheeks where you've lost fat. And the advantage of doing that is that I can actually get a little bit under the eyelid here, so if you've lost some volume under the eye, I can address that issue as well. And then the last option that is the quickest is using hyaluronic acid fillers. Those are temporary because they only last between a year to 2 years, but is a good option if you don't want to have a surgical procedure. What does getting a cheek implant mean? Well, I usually can do that under local anesthesia in the office. And that's because this entire area of your face is given sensation by one nerve in your cheek called the infraorbital nerve. I can numb that nerve up, and then you really don't feel much of anything during the procedure. I lift up any tissue off the bone and slide in a cheek implant through tiny incisions in your mouth. I leave dissolving stitches through those incisions, and afterwards you use a mouthwash and antibiotics and have pretty limited swelling. The main risk to getting a cheek implant is, one, getting a pocket of fluid in your cheeks, which needs to be drained, infection, or numbness to your cheeks that lasts longer than a couple of weeks. I expect that most people will have numbness in their cheeks because the implant is adjacent to the nerve that gives sensation, and that gets better, in a week to 2 weeks, and can take a few months if the implant is large. I do also see some swelling for at least a week, but usually resolves by about 2 weeks. And you see your final result after that and look great.